Welcome to Highland Waves, a podcast coming to you from Marshbrook Studios, located beside the world-famous Margaree River in Cape Breton, Nova Scotia, Canada. At Highland Waves, we feature stories about the people, places, and the visitors who come to Inverness County. I'm Pat Wall, host of Highland Waves, and in a rare evening interview, I'm pleased to introduce our guest, Nia Kakamousias. Good evening, Nia.
Good evening. Thanks so much for having me.
You're welcome. Nia is a working visitor to Inverness County. She's a pharmacy student at Dalhousie University in Halifax, who's decided to do her fieldwork at the Inverness Consolidated Memorial Hospital. This evening, Nia is going to give us a glimpse into her journey to eventually becoming a doctor of pharmacy. We're pleased to have you with us here in Inverness County, Nia. Where are you from originally?
I'm actually born and raised in Halifax, so I've lived there my whole life. I've visited Margaree and Inverness County a lot growing up, so I'm familiar to the area, but Halifax is where I call home.
Kakamousias is a Greek name, isn't that?
Yeah, it is.
Your dad born in Greece?
No, my dad was born and raised in Halifax as well, but both of his parents are Greek, from Greece, immigrated pretty young. My grandfather was only 16 when he came to Canada, and both from pretty small villages in Greece. My mother is Canadian. She was born in Ottawa and raised in Cole Harbour.
You have siblings?
I do. I have two. I'm the oldest sibling. I have a younger sister named Annie. She's 22 years old now. She's actually a medical student at Dalhousie, so I see her around every once in a while. And then my brother Costa is 10. So pretty big age gap there. He is in elementary school in the west end of Halifax.
So your sister is studying to be an MD.
She is, yes.
Wow, you're going to own your own clinic.
I know, right? 2 doctors in the family. But in Inverness, there's a couple sibling duos at the hospital I've seen. So something I aspire to, I would love to practice medicine with my sister. I think that'd be really cool.
That would be great.
Yeah.
Where did you attend school in Halifax?
So starting from the beginning, I went to St. Catherine's for my elementary school, which was in the west end of Halifax. I went to Oxford Junior High School. Through those 2 schoolings, I was able to do the French immersion program, and then went to Citadel High School to finish off there.
What were some of the challenges you encountered during your early school years?
I'd say I was an athlete growing up. I'm a little bit washed up now, but when I was going through school, I played a few sports, soccer, volleyball mainly. Managing your time is a really big thing when you're growing up. So I think kind of figuring that out as I got older, trying to balance school and academics and sports and things like that. So not as much in elementary school and junior high school, but when you get into high school, that's when you really learn how to manage your time and that sort of thing. So I'd say that was one of the bigger challenges.
Did you get lots of support?
Lots. My parents are the sun and the moon, the stars. They drove me to every practice, attended every game. My parents are my biggest fans. So I owe them a lot for the being able to do as much as I did. And I see it now more with my brother because I'm older and I can kind of see what goes on behind the scenes. When you're a little kid, you don't notice as much, but now that I kind of see him growing up, I kind of see the amount of stuff they do. So I owe them a lot of credit.
What did you like about those early school years?
Being an athlete was a big part of my personality then. And you meet so many people, and all of my best friends, or most of my best friends growing up, were from the sports I played. And especially in high school, my best memories are from playing on the sports teams at Citadel. So I'd say that probably there's nothing better than playing with people you like and a sport you like and winning games and stuff. So I'd say that was probably my favorite part.
Did you attend an advanced program in high school?
I did, yeah. I took the IB program in high school, which is the International Baccalaureate program. It's an internationally validated program, so everywhere you go in the world, it's the same. The exams are the same. The curriculum is standardized across the world. So it's like a step up, I guess, from the traditional high school curriculum. So yeah, I did that. It isn't offered in the 10th grade. It's like a pre-IB program, but in grade 11 and grade 12, I did do the advanced program.
Great. Now that you've been through the elementary, junior, high school, and the IBA, what is your advice to people entering and going to high school?
I feel like I'm like repeating the same thing, but being well-rounded was a big successor for me, or like helped me reach success later on in life. So it doesn't have to be sports, like anything you're interested in. Like I'd say school isn't everything. You want to do your best and try hard, but being involved in other things and not being a one-trick pony, so to say, and like being in art or being in sports or being in music or anything you want to do, I think is really important to have more things that make you you and not just hunker down in the books, while that still is important.
Sure.
Yeah.
At what point, or was there a point in time when you feel you wanted to go to university?
I don't think there was ever a point where I really considered not going, to be honest, just because of the way I was brought up. I mean, when I was going through high school, pretty much everyone that I was around was going to university. All my friends went to university. My parents are both Dal alumna, so it was kind of already ingrained with me when I was going to university. So, I mean, I didn't really start thinking about it probably till I was like late in grade 11 or early grade 12, when you really start thinking about where you want to go.
Why did you pick Dal?
Honestly, mostly convenience more than anything, because I was in Halifax. My parents lived in Halifax. It was easy for me to stay at home, save a little bit of money, and stay home with my parents especially for my first year of university. So, I mean, I knew when I was in high school I wanted to do science. I was really interested in science, and I honestly wanted to go to medical school in high school, but I ended up not doing that. And I knew Dal was very strong in that area, so it kind of was a perfect fit, where it was close and it also had a really strong science program. My undergraduate degree is in medical science, and that was kind of a more unique degree to Dalhousie. Like other schools do have the kind of medical science-y kind of degree, but Dal had a really strong and very specific and unique kind of program. And I honestly owe it to my dad. Was the one who kind of pushed me to do it. And I was like, I don't want to do this program. It seems really hard. But my dad like got me into that, and he knew it was good for me before I did. And I had great success there. So it all kind of was just like a perfect storm. Worked out well for me.
Well, great. You graduated with a Bachelor of Science in Medical Science.
Yeah.
How many years was that?
4 years. I did, yeah. It took me 4 years to do that degree.
And then it was on to pharmacy school. Mm-hmm. When did you decide you wanted to do pharmacy?
I took my first pharmacology course during my second year, and I was really interested in it. I like the science of drugs. I had a great professor. The coordinator of the course was really excellent, and she actually ended up being one of my professors in pharmacy school, so it worked out pretty well. But that kind of drew my interest in pharmacy. I've been around a lot of great pharmacists. I have a few pharmacists in my family, some aunts who are pharmacists. And I've just been around pharmacists in the community. I would go to pick up prescriptions and I would just interact with friendly, helpful pharmacists. And I was like, wow, I would love to be this sort of person to somebody else, make them feel comfortable in this sort of setting. So that kind of piqued my interest in pharmacy. To be honest, I applied to the Dalhousie pharmacy program my second year of university and didn't get in. And then at that point, I was like, well, might as well just finish my degree. So I did my third and fourth year at Dal, and then I applied during my fourth year and got in.
Nia, perhaps you could take us through pharmacy school to now.
I started working in pharmacy actually before I got into pharmacy school. So I started my pharmacy school in September of 2021 and started working in pharmacy around February of 2021. And then, so I had a little experience in the pharmacy before I got in. First year, I was working the whole time. First year is getting your feet wet a little bit. You do your first year from September until the end of April. And then after your first year, you do a 4-week community placement, so a community pharmacy that you would be used to in terms of just getting your drugs and that sort of thing. So you do 4 weeks there as a student. And then that summer I also worked in community pharmacy. And then I just finished my second year. So Your second year is a little bit of a step up in terms of curriculum and difficulty. After your second year, you do 4 weeks in a hospital pharmacy. So that's what I'm doing here at the Inverness Hospital. So you do 4 weeks of a clinical placement there. And then that's where I'm at right now. I'm actually, when I'm not in Inverness, I'm working in Halifax. I work at the IWK, which is the Children's Hospital in Halifax. I'm on a research grant. I'm researching substance use disorders in youth. So that's where I'm at right now.
Thank you. People often ask, what does a pharmacist do? Do you make drugs besides other tasks?
So I think a big thing in pharmacy in general is just people, the general public, just not really understanding what pharmacists do and how much our scope has expanded over the last 10 years. I mean, we do the traditional things where we check prescriptions and do that sort of thing. But I'd say one of the main roles of a pharmacist is kind of being a second set of eyes for physicians and nurse practitioners. So whether you get a prescription in a community, you get a prescription in hospital, a pharmacist is checking that, making sure the dose is appropriate, making sure that the drug is appropriate for whatever condition you're treating, making sure it doesn't interact with your other medications or is inappropriate for any other disease that you have. There's a million things that we have to check and make sure is safe before a drug gets to your hands. The big change in the last 10 years is our clinical abilities and our clinical scope. So by that I mean what kind of helping with prescribing for minor ailments. So how now you can go to a pharmacy and get a prescription if you have allergies, or people get birth control prescriptions, or if you have a UTI and that sort of thing. So pharmacists can assess you and prescribe. So we have a pretty wide range of conditions that we can assess and prescribe for. Especially during the COVID pandemic, we've realized now that pharmacists have a big role in terms of giving injections. So we spearheaded, by we, I don't mean me, but we spearheaded a lot of the COVID vaccinations. We do flu vaccines every year, so that's a big role for pharmacists. We do a bunch of other things like renewing prescriptions. If you run out and you can't get in to see your doctor, we can do assessments for that, or adapting a prescription. If a drug is unavailable, we can switch the drug and change it to something equivalent without the need for your doctor. And then we're also just resources for drug information. So in the hospital especially, we have a lot of doctors reaching out to say, what do you know about this drug? Or I need help dosing this drug, or that sort of thing. So just kind of being a reservoir of drug information and that sort of thing. So I think it's really important for people to really understand all the things we are able to do. So, yeah.
Yeah, I always thought that the pharmacy profession was underutilized. But it seems now that there's more of a team approach, I think.
Yeah.
Where you're, with doctors, nurse practitioners, it's more widespread than I know in my time.
Yeah, for sure.
What would you like to practice when you finish your training?
I really like hospital pharmacy. I've known for a while, pretty much my whole degree, that I wanted to practice in hospital. Where I have worked in community for almost or over 2 years now, I have seen the value in what community pharmacists do and that sort of thing. So I do appreciate community pharmacy and I like community pharmacy, but I like being in the hospital. The hospital, like you mentioned, is a more collaborative team approach. You work with the doctors and the nurse practitioners, and it's much more rewarding, I find. You use a lot more of your knowledge and you kind of feel like you're contributing a lot more than you do in community pharmacy. That's not to say the community pharmacists don't have a wealth of knowledge and aren't valued members of a healthcare team, but I find in the hospital you really get to input and do that sort of thing. So I would love to work in hospital. I like the idea of working in Halifax. I like the larger urban centers. The good thing about working in a more rural place like in Inverness is you really get to touch on everything. The pharmacists in Halifax are more specialized, so they would specialize in heart or they would specialize in cancer, that sort of thing. But in Inverness, you really do get a wide range of you see a wide range of conditions, so you're more of an expert in everything.
Okay, so a generalist, more or less.
Yeah, exactly, yeah.
But getting back to the community pharmacist versus the hospital pharmacist, They can be interchanged, though, at any one point.
Yeah. So do you mean like you could work in either?
Yes.
Oh, yes. So once you have your pharmacy degree, you can do either. The big thing about hospital pharmacy is to be competitive, especially in bigger cities, you need a residency, which is a 1-year training program to basically get you primed to work in a hospital. So a lot of people, this is my goal personally. Once I graduate, you do a residency at a hospital, and then that makes you more competitive to work in the hospital. But a lot of the time, people who work in community and have all that experience for years and years, they do have that advantage. So basically you could work in either, but it just kind of like where your experience is and what your training's in kind of makes you more competitive for one or the other.
Okay. Some young people who are listening may need some advice to advance to their professional dream. Mm-hmm. Have you got some advice for them in that regard?
I would say in university. In high school, I had no idea what I was doing, and I kind of just you kind of just have to work your way through and kind of try a bunch of different things to figure out what works for you. I've changed my career a few times at this point. So I think even in university, trying out as many things as you can, as much as your degree will allow you to do, try and take weird courses and things and see just what fits for you. You might think that you're science minded or business minded, but then you take a course in whatever and you find you have a widened interest. So I'd say in university, try to do as many things as you can to kind of see what you enjoy. I think a big thing I'm realizing as I get older is connections are everything. And even just introducing yourself to your professors. Every professor you have, go up and say, hi, my name's so-and-so. And then that kind of a lot of people don't do that. So when you do that, you are in their mind and kind of helps you build relationships, and especially in academia and in research, if that's your interest, those things are big. So kind of putting yourself out there, don't be shy. I know I am guilty of that. I'm very shy when it comes to that sort of thing. I don't want to embarrass myself, but I kind of had to get out of my shell and just email people and be like, hey, I'm interested in the work you're doing, or I'm interested in whatever. And kind of just getting your foot in the door can be really helpful later on.
Extracurricular activities are good too, are they not?
Oh, yes. Yeah. I mean, I am a big proponent of that. I did extracurriculars all through school. Being a part of a team really is valuable later in life. And I feel like I use that a lot in my professional career. People see that as an asset if you are a member of a sports team or you're big into theater and you're part of a group that way. People like that you can work in a team and communicate with others. So doing that through growing up in your junior high school, university is big. I'd say a thing that helps me in university as well is I just do things for fun, have hobbies, just something to get your mind off the stress of university. I love to play intramural sports. So that's kind of a thing keeps you happy. You just got to kind of do things that are fun besides just academia all the time. Yeah.
I guess volunteerism is very important as well.
Yeah, I've done a bit of volunteering throughout my university career. And you don't realize what you're interested in until you've volunteered. I've volunteered at some seniors' homes and things like that, and it's just crazy what you see when you just get your foot in the door volunteering. So people look for that in applications for things and stuff. So volunteering is really big.
Back to your eventual profession. Mm-hmm. What advice can you give to patients who think they need drugs for various ailments, or for those who've been prescribed drugs by their doctors and are not quite sure whether they should take them or not?
I mean, yeah, it's really hard to know, for the general population, knowing what you should be taking and what you shouldn't be. I know for myself personally, and most of the people that I know, we will never be irritated if you ask a question. We would much rather you ask and clarify, even if you think it's a stupid question, versus going home and just taking pills because you think you're supposed to and not knowing anything about your health. So, because you'd be surprised how many people come in and they're like, I'm taking this pill, I have no idea what it's for. And I'm like, well, I would love to take the 2 seconds it would take to explain this to you and make you feel more comfortable, because no one wants to take something if they don't know what it's for, because I would be kind of nervous to do that. So I would encourage everybody to just ask questions. Don't be worried that you're irritating anybody. It's something we're trained to do, and we're happy to answer.
Communications between the pharmacist, the patient, and the doctor is also a vital part of what you do.
Yes, definitely. I'd say, especially in the community, we are often the middleman for patients and their physicians. Like if patients need refills or patients, are missing a drug or anything, we are often the ones that reach out to the doctors to get those sorts of things sorted. So I think that's a really important part of our job, or just like trying to get people connected. People are having a hard time, like in Nova Scotia especially, people don't have family doctors. So helping people navigate that system as well. So we've kind of developed communication systems that have sort of worked, and we've worked hard on those. So really important.
Well, a topic that nobody likes to talk about, but it's with us every day, illicit drugs and the misuse of them.
Yeah.
What is your advice for people trying to stop using or misusing drugs?
So this is actually what my research is in, so something I love to talk about. And I think it is hard to talk about this topic without talking about the stigma that comes with substance use and illicit drug use in the healthcare system. People who use substances are often nervous to come to pharmacists, come to doctors, because they worry they're going to be judged or something like that. So the big first step in general for everybody is kind of being educated on substance use and trying to take a non-judgmental approach, so people are more likely to come forward about their use. I'd say the first thing for someone who's using substances is to try to reach out to an organization that specializes in that sort of thing. For example, in Halifax, a couple of examples would be like Direction 180 or the Brunswick Street Mission. They have safe injection sites, and these people there are trained in substance use, and they know what to do when someone comes in asking for help. So going somewhere where they specialize, they'll know where to point you in the right direction and point you to a doctor, point you to a nurse. They know what's going on there. So I'd say that's the big first step. And again, pharmacists are a great resource here to go up. We dispense treatments for substance use disorders all the time. So we're well trained in the treatment for this. So if you have a question, you can just ask your pharmacist. They'll point you in the right direction. We have lots of resources, lots of physicians that specialize in this sort of thing. So we're a good sounding board for that. But again, I have to emphasize how difficult it is to just say, oh yeah, just go and get treatment for your addiction. Like, it's a very hard thing to do. So any step is good.
It seems that the larger centers do have those services available quite frequently in the in the rural areas. We don't have those. So the pharmacist is a key person, I would think, in that regard.
Oh, definitely. In terms of like treatment, like opioid agonist treatment, which is, if people know what methadone is a treatment for opioid use disorder, and it's something that we dispense every day in the pharmacy. So it's a good, and in rural centers, there has to be somewhere that dispenses this. So there's always somewhere and someone who's an expert on substance use treatment. So in the rural centers, the pharmacists play a big role.
Is there anything else you would like to add?
No, I wish I had like 3 hours, but like pharmacy is, I think my frustration with pharmacy is just that people just don't understand what we're able to do. So a lot of people's anger, and I appreciate the anger about their healthcare and that sort of thing, but it comes from not really knowing what we're about, what we're able to do. So I would love to just have everybody know what pharmacists are able to do and how important we are in the healthcare system.
More communications is probably a good area to start.
Yeah, I mean, we do have like a Pharmacy Association of Nova Scotia, and they try to put out information about the practice of pharmacy and that sort of thing. So keeping an eye out for that. They advertise what we're able to do. So and always just ask and call and see what people are able to do.
Well, thank you very much for joining us and shedding a light on your journey through your early school days and the study of pharmacy. Your experiences will, I'm sure, help those embarking on their journey through their life. Your practical advice on drugs is no doubt a benefit to those experiencing difficulty with them. And I hope the remainder of your journey towards your doctor of pharmacy will be as successful as it has been to now. Good luck with it all. And thanks to our listeners. Please hit the like and subscribe buttons so you can stay up to date. Finally, our thought for today comes from Thomas Argyle, who said, "Without kindness, there can be no true joy." So long for now, Pat.